Assalamu alaikum. My name is Tuba Shakil, roll number BP1650240. I'm from 5th Prof Morning and the course number is PhD 705. And I'm going to discuss about the drug levothyroxine. So, first we have to know what levothyroxine is. The levothyroxine is a synthetic version of the thyroid hormone thyroxine, that is our body's natural hormone. So the drug is used to treat hormone deficiency, including the serious type of conditions like myxedema, coma, and can also be used and to avoid thyroid tumors in some cases. Now, mechanism of action. First, we have to know what is the function of thyroid hormones in our body. Thyroid hormones function by binding to thyroid receptor proteins found in the nucleus of the cell. Thyroid hormones operate by directly influencing the DNA transcriptions to increase the body metabolism by increasing many important functions like gluconeogenesis, protein synthesis, glycogen mobilization, and other functions once within the nucleus. T4 levothyroxine is a synthetic form of thyroxine. So, that is the body's natural thyroid hormone. The hypothalamus normally produces the thyrotropin releasing hormone TRH, which stimulates the anterior pituitary to produce TSH, that is thyroid stimulating hormone. The name indicates that this hormone stimulates the thyroid to produce 80% of thyroxine and 20% of L-triiodothyronine, that is T3. So if the thyroid is not producing enough amount, so major functions are stopped. So we have to take the thyroid hormone replacement in like in the form of levothyroxine drug, that is a synthetic hormone. Now, rational use. The hypothyroidism is treated with levothyroxine, a condition where the thyroid gland does not produce enough thyroid hormone, and thyroid cancer is treated with surgery and radioactive iodine therapy. Hormones are the form of drugs that includes levothyroxine. Now, irrational use. Uh, when the patient take the drug on the full stomach and taking the levothyroxine with the additional medications without even knowing the drug-drug interactions include the irrational use of levothyroxine treatment, and it may interfere the levothyroxine absorption and efficacy of the drug also varies. The indication, it is indicated in the underactivity of the thyroid gland, like in case of hypothyroidism, it replaces or increases the amount of thyroid hormone released by the thyroid gland. Adverse effects includes increased appetite, weight loss, heat sensitivity, excessive sweating, headache, hyperactivity, nervousness, anxiety, etc. Drug interactions. The drug which interact with the levothyroxine absorption include calcium carbonate, aluminum containing antacids, sucralfate, iron supplements, many other drugs, ciprofloxacin like roloxifene and etc. Drug toxicity with mechanism. While toxicity of levothyroxine is very uncommon and side effects are uh, possible side effects are there in case of toxicity, but these are rare. The possible side effects are tachycardia, hypertension, anxiety, diarrhea in the early stages of overdose, 6 to 12 hours after ingestion, convulsions, thyroid storm, acute hysteria, arrhythmias, and acute myocardial infarction. Uh, it toxicity occurs in case of overdose or in case of children, or dose variation in case of adults and children. Dosage and administration, we have different dose for adults, geriatric and pediatric. So for adult, it is 1.6 mcg per kg oral once daily, and for geriatric dose, initial dose of 12.5 to 25 mcg oral, and for oral OD, and for pediatric recommended dose is 10 to 15 microgram per kg per day. Now it is available in different dosage form and strengths. Like its injection is supplied as a lyophilized powder at two strengths, that is 100 mcg and 200 mcg. Alternative choices are also there. Cytomel is manufactured form of thyroid hormone triiodothyronine. So, like thyroxine, levothyroxine, it is a synthetic thyroid drug. So, We can also go for Cytomel, and we have different brand names: Thyroxine, T4, Thyroxine Sodium, and different manufacturer with the different trade price and retail price, and we can decide according to economical prices. Case study or soap notes. A 50-year-old housewife complains of progressive weight gain of 20 pounds in a year. Fatigue, postural dizziness, loss of memory, slow speech, deepening of her voice, dry skin, constipation, and cold intolerance. The vital signs include the temperature 96.8 degree Fahrenheit, pulse 58 per minute, and regular BP is 110 by 60. She is moderately obese and speaks slowly and has puffy face with pale, cool, dry, and thick skin. Thyroid gland is not palpable. The deep tendon reflex time is delayed. CBC and differential WBC are normal. The serum T4 concentration is 3.8 Ug per dl. Serum TSH is 1 UU per ml, and the serum cholesterol is 225 mg per dl. Now, subjective. Gender female. Age 50 year, weigh 20 pounds. Symptoms include fatigue, postural dizziness, loss of memory, slow speech, deafening of voice, dry skin, constipation, cold intolerance. The vital signs include temperature 96.8 degree Fahrenheit, pulse 58 per minute, regular BP 110 by 60, and she is moderately obese, puffy face, pale, cool, dry, and thick skin. Objective. The objective includes the CBC and differential WBC are normal. The serum T4 concentration is 3.8 Ug per dl. The serum TSH is 1 UU per ml, and the serum cholesterol is 255 mg per dl. Now, assessment. Secondary hypothyroidism or tertiary hypothyroidism less likely. We have more chances of secondary hypothyroidism. So let's go towards plan. For plan, first we have to evaluate if there is secondary hypoadrenalism or not. If secondary hypoadrenalism is there, so we treat it simultaneously with the treatment of hypothyroidism and continued levothyroxine for the treatment of hypothyroidism with the initial dose of 12.5 to 25 mcg per oral q day, and adjust the dose by 25 mcg per day q 2 to 4 week PRN, and monitor serum TSH concentrations for further adjustment in the dose. And we titrate the dose according to the serum TSH concentrations and adjust the dose according to TSH level and also according to body weight. Now, different references are there from which I take the material. Jazakallah, Allah Hafiz.